We're going to discuss now certain things that can cause intoeing. And anywhere along the line, your toes can be pointed in because the toes are pointed in, or because the entire foot is pointed in, or because you have tibial torsion, or what we call femoral anteversion. So all of these can cause intoeing. Metatarsus adductus is where the toes are actually pointing in. Usually you can move them. They're somewhat flexible, and you can move the toes into a neutral position, and typically they don't need any treatment. Sometimes people will put shoes on backwards, or they may need casting, but typically they don't need any further treatment. If it persists, then you have to have orthopedic surgical referral. Talipes equinovarus. This is club foot, a little bit different. The toes may be turned in, but the important thing when you're reading the test question, because there's not a best test for this, it's a clinical diagnosis, is that not only are the toes turned in, but the heel is deviated medially. And so you won't be able to put the heel onto the exam surface flat. It'll be twisted in like this as opposed to like this. This is club foot. We'll show you a picture shortly. These patients do need serial casting, and you try to get it to the midline. It is a stiff foot. It cannot be moved passively into the neutral position, and sometimes the affected foot is slightly smaller than the normal foot. Sometimes both feet are affected. This is a patient with club foot. You can see that the heel, as you can see, that the toes are turned in, but the whole entire bottom of the foot is also turned in because there is deviation here, basically at the ankles. This foot, the toes kind of turn in a little bit. This is a little bit of metatarsus adductus, but you can see that the heel is flat on the exam surface, so this is not club foot. Here's bilateral club feet, and you can see how the heels are deviated medially, and you cannot put the foot flat on the exam surface. If you were to stand this child up, basically he'd be standing up on the outside part of his foot. Femoral torsion or femoral anteversion is another form that causes intoeing. This is the most common cause of intoeing in a child greater than 2 years of age, and it's usually because of abnormal sitting position. Unfortunately, even I can't do it because I'm too old and too stiff to show you the position, but you see the way that a child sits, it almost looks like an M with their legs splayed out like this, and what that does is that it puts undue torsion on the femurs, and so they twist in, the knees twist in, everything below it twists in. So when the child walks, the feet are turned in, the toes are turned in. Usually it doesn't cause problems as far as running or jumping or playing or even pain. When you see the child, ask them to sit down, and you see how they sit down in their preferred position, and you can say that's why it's happening. The other thing you can do is watch the patient walking, and when they walk, the knees are pointed inward and towards each other. That's femoral anteversion. No special test, just watch them walk, do a good physical. And then internal tibial torsion, what happens there is that the tibia is internally rotated, so everything distal to it is also pointing in, including the feet and the toes. The outside part of the foot in both of these is basically very straight with internal tibial torsion. This is the most common cause of intoeing less than 2 years of age. Again, children have no problems running and jumping and playing. Doesn't cause much problem as far as pain, and usually there's no treatment required. On exam, when you see them walking, you will see that the knees are pointed straight ahead, but when you look at their feet, the lateral malleolus, it will be rotated forward and maybe even with the medial malleolus, or actually anterior to the medial malleolus. That lets you know that that's internal tibial torsion.